Hey there, I'm here with John today.
Hey.
John has a bulging disc at L1 and L2, so today we're going to put him on this table and we're going to do some lumbar traction with him. Lumbar traction, it's going to decrease that intradiscal pressure, which is going to push some of those disc fragments back into the space. It's also going to decompress the nerve root, so it's going to kind of get rid of some of his neural symptoms as well. All right, John. So before we get you on the table, I have a couple questions to ask you.
Okay.
Has your doctor told you not to move your neck or back for any reason? No?
Nope.
Okay. And when did you have this injury?
It was about a year ago, I believe.
Okay. So if it was in the acute phase, we probably wouldn't be doing the traction. Have you dislocated any joint in your lower back?
I have not.
No.
No.
Okay. And are you claustrophobic?
No.
No?
I'm totally fine.
And no problems laying on your back?
Laying on back is good.
Okay.
Yep.
Any history of high blood pressure?
No.
No?
No.
Okay.
Blood pressure's good. Yeah.
I would have looked at his MRI, and if he would have had a medial disc herniation, we would not be doing traction. And if he had too much displacement of that annulus fibrosus tissue, we also would not be doing lumbar traction. All right, John. Well, now we are ready to get on the table and get set up.
Okay.
First thing I want to do is I want to hook this up to the table so that when the traction is being performed, John's not going to go anywhere. So, John, go ahead and lay down on your back with your bottom about right here. We're going to have the L1, L2 going right at this line because this is where the table is going to open. Very good. So now that this is all set up, we have a little port right here that's going to go to the machine. How's that feel, John?
Great.
Great. The next thing we're going to do is we're going to place this stool under your knees because the more flexed that your hips are, the higher the joints it's going to be. So since we're doing L1, L2, we're going to want his knees flexed to about 90 degrees. So go ahead and bring your legs up for me. All right, perfect. How does that feel?
Feels good.
Great. All right, and we are ready to set up the machine. So now we're going to set up the machine. What we're going to do here is we're going to click lumbar traction. We're going to edit. We're going to make sure that it's on intermittent. We're going to go to steps. We're just going to turn it to 1 for each. This is a progressive steps. This is regressive. We're going to turn the total time to about 20 minutes. And we're going to do edit max and min levels. So, John, how much do you weigh?
I weigh 200 pounds.
200, okay. So, for spinal... Okay, so for disc problems, we're going to do about 25% of John's body weight, which is going to be 50 pounds total for the max. So for the min, we're not going to go all the way down to 0, but we might go to about 10 pounds. And then for the edit, hold, and rest times, we're going to have 60 seconds on and 20 seconds off. It's already set like that, so perfect. And then we're going to go ahead and we're going to hit rope release. We're going to attach it to John's ring. And we should be good to go. Now that John's all set up, the machine's all set up, I'm going to give John this red button, and if he decides that the treatment is too much and he wants to stop it at any point, he can click the button, and as you see here, the treatment will stop. Okay, now that we are ready to start, I'm going to go ahead and unlock the table by pushing down on this handle right here. This is going to allow his L1, L2 joint to be separated. All right, well, it's been about 3 minutes. John, how are you feeling?
Feeling better.
Better?
Yes.
Okay. And is your pain completely gone?
No, not quite.
Okay. If it was completely gone, that would indicate a complete nerve block, and we don't want that to happen, so we would shut off the machine. All right, now that John is done, I'm going to go ahead and lock the table back up. And John, how are you feeling?
Pretty good.
Pretty good?
Yeah.
And the symptoms are getting better?
They are.
Okay.
Yeah, that helped.
Great. Well, thank you very much.